So coronaviruses are a group of RNA viruses, not dissimilar to influenza, but they happen to be in a bunch of different animal species, and sometimes they jump over into humans. We actually have 4 coronaviruses that circulate every year, usually around the wintertime, that cause common cold symptoms. We've also happened to have had 2 severe coronavirus-type outbreaks with SARS and MERS in the past 2 decades. And now we have a new coronavirus called novel coronavirus 2019 that's currently spreading in China and a little bit outside in the rest of the world. So the coronavirus, although we don't know as much about this novel coronavirus, we know a lot about how other coronaviruses spread. And so what we suspect is that this coronavirus is spread by droplets. So if someone is coughing, for example, those droplets will spread throughout the air to about a distance of 3 feet before they fall. So if you're worried about becoming infected with the coronavirus, you're not going to get it from someone coughing about 6 feet away. But you could get it if someone is coughing right next to you, if they cough on their hands and then shake your hands, and if you don't wash your hands after touching something that might have been contaminated with a little bit of the coronavirus. So the simplest protections really are the easiest. We really want everyone to be washing their hands. It's flu season. Everyone should be doing this anyway, but be aware after you touch a doorknob, after you shake someone's hand, wash your hands, particularly before you touch your face, eat food, touch your eyes, anything like that. If you are someone who is sick and coughing, just be kind to others and cough into your sleeve or wear a mask. I'd first want to emphasize that while there's a very severe outbreak going on in China right now, we actually have very few cases here in the United States so far. So if you have been to China, or if you do know someone who had this novel coronavirus, and you're starting to feel sick, do please contact your doctor, call them first, call the ER if you think you're sick enough to go there and let them know you're coming, so that they can make sure you have a mask on when you come in to protect other people. However, if you haven't been to China and don't know anyone who's had this virus, it's much more likely that you have the flu. We are in a very severe flu season right now. So if you have all of these symptoms but haven't been in touch with anyone who's had this novel coronavirus, take care of yourself as if you had the flu. Practice good basic hand hygiene, and if you haven't been sick, get the flu shot.
Greetings, sailors, Marines, and families. I'm Rear Admiral Bruce Gillingham. As Surgeon General for our Navy and Marine Corps team, I want to take a few moments to talk with you about the novel or new coronavirus. This is the virus that was first detected in Wuhan, China, and has been in the news recently. Our Department of Defense and Navy leadership have been actively engaged on this issue to help protect you and your family. The guidance and procedures we are following are closely coordinated with our interagency partners, especially the Centers for Disease Control and Prevention, or CDC. This ensures accurate and timely information is available, and all appropriate measures are taken to prevent the potential spread of the virus. Based on the information we have at this time, the overall threat of contracting the novel coronavirus outside of China is low. Colds and influenza are far more common. Navy and Marine Corps personnel and their families who have recently traveled to China should be aware of respiratory symptoms such as fever, cough, sore throat, or difficulty breathing. Should a service member or family member who has recently traveled to China experience any of these symptoms, they should call ahead to their medical provider to receive additional instructions for clinical care. There is currently no vaccine to prevent the novel coronavirus. The best way to prevent infection is to avoid exposure to this virus. To help prevent the spread of viruses, the CDC recommends the following: avoiding close contact with people who are sick, avoiding touching your eyes, nose, and mouth with unwashed hands, washing your hands often with soap and water for at least 20 seconds, or using an alcohol-based hand sanitizer. The readiness of our forces and families requires ensuring we are all in the best health to perform our duties and take care of our families. If you do become ill, take the right actions to keep others from getting sick. When you are sick, stay home or follow your local sick call procedures. Cover your cough or sneeze with a tissue, and then discard the tissue in the trash. Clean and disinfect frequently touched objects and surfaces. And know this: my team is working on this situation, is in frequent contact with every Navy and Marine Corps medical department and facility around the world. Every healthcare provider in the Navy and Marine Corps is being provided the latest information and treatment recommendations. If we do what is necessary to protect ourselves and our families, we can avoid illness, stay healthy, and complete our missions. Be smart about your travel precautions, and what you can do to protect yourself and your family. Remember this, Navy Medicine is here for you. If you need help or have additional questions, please contact your local medical representative. The CDC website has the latest and most up-to-date information. The Navy and Marine Corps Public Health Center website also has information on the novel coronavirus. Thank you for your attention to this important health information. Just as you defend our country 24/7, Navy Medicine will continue to work around the clock to protect you and your families. We have the Medical Watch.